come up. Okay, hopefully everybody can see that. Zoonotic
Yes.
diseases and what you should know. Make sure I get in the right place, and I'm going to expand this. Okay, so especially in the current age of COVID-19, a lot of people, the general public, have been introduced to this new word, zoonosis or zoonotic disease. And typically speaking, zoonosis is an infectious disease that spreads from animals to humans. That's the most common way people think about that word. And it's quite common that infectious agent, that disease process, has no ill effects on the host animal, just on us as the sort of the victims. Because we don't have any natural immunity to those diseases, the risk to us can be enormous. This current pandemic really provides a really big reminder that handling in close contact with wildlife and wildlife body parts and excretions can pose a risk of spillover of those infectious pathogens and can result in zoonotic infections. The notes will be available, pretty much copies of all these slides will be available from Velda afterwards, and so that's a nice little review article listed at the bottom. So this is an overview of what I'll kind of go through, a few basic definitions. Why is it important for us to kind of get up to speed a little bit on zoonotic diseases? I have a list of disease examples, things that we all probably have heard of. And then I will use the various routes of transmission to use specific diseases, 2 or 3 specific diseases for each route of transmission as examples, and then sum things up with ways that we can try to reduce the transmission of these diseases. So, as I mentioned, zoonosis is an infection or infestation that's shared between animals and humans. Notice that it doesn't specify from animals to humans. It can actually go either direction, and so animals can get diseases from humans as well. We can be more specific by saying anthropozoonosis, which specifies that it's a disease transmitted from animals to humans. The opposite would be called a zooanthropomorphosis. That's a disease from humans to animals. And an example would be that elephants are quite susceptible to tuberculosis from people. And meaning the same thing, reverse zoonosis is another term that means that animals are getting the disease from us. Endemic pertains to all of this, and we think of an endemic disease as one that's maintained in a narrowly defined region or population, and it's kind of there at a low maintenance level quite commonly, like the common cold, and kind of stays present. Whereas an epidemic is rapidly spread to a large number of people, and a pandemic is basically an epidemic that spreads between nations. It's worldwide spread of the disease, and that's what we get to experience right now. So currently there are over 200 recognized zoonotic diseases. About 1 billion, with a B, billion cases of human illness each year are due to zoonotic diseases, and millions, plural, millions of human deaths each year are attributable to zoonotic diseases. 60% of all known human diseases and 75% of recently emerging diseases, recently recognized diseases, are in that category of zoonotic. A recent report from Centers of Disease Control and Prevention noted that cases of mosquito, tick, and flea bite-related illness has more than tripled in that period from 2004 to 2016. And specifically, mosquito-borne disease epidemics are increasing in frequency. Again, just recently in the last 10 years, 7 new tick-borne germs have been identified in the United States that can infect people. That's not all the tick-borne diseases, that's just recently recognized ones. Another reason it's important to think about zoonotic diseases is because there is risk that they could be used in bioterror events. And I'll mention a few of those briefly. So I think it's important to have a good understanding of the underlying risks associated with these and have a healthy respect for the potential for transmission. And this can help us think about sound preventative measures that will help protect ourselves, our family, and our community. And as members of these volunteer organizations, our goal and our purpose is to protect family and community. So hopefully this will help us to keep some of these considerations in our minds if we ever are faced with some of these bigger disasters. So these are just a handful of examples of zoonotic diseases that most of which I suspect we're familiar with or at least have heard of. West Nile virus has certainly been in the news in the last few years. Swine flu, malaria, anthrax, TB, rabies. And so things like anthrax, plague for sure, possibly leptospirosis, I think salmonella, those are all infections. Smallpox would be another one that would have potential to be used in bioterror. So there are 5 basic routes of infection for zoonotic diseases. They are not exclusive. Disease can certainly be transmitted by multiple of these, not necessarily one, but I will use some of those diseases as examples to think about each possibility. So fecal-oral transmission is one of the more common ways that these diseases can be transmitted. E. coli is certainly considered a common intestinal pathogen that can be passed. But all of these we need to think about, including sort of intestinal parasites like hookworm and tapeworms. And although we don't go out to intentionally consume poop, at least most of us don't, it's very easy to bring it home on our shoes or touch a surface where some of these organisms might have been deposited, and it can be a microscopic amount that can lead to infection. So important to keep that in mind. So I'll just share a couple of slides on salmonella. Salmonella is caused by a gram-negative bacteria, a motile bacillus. The most common illness is acute abdominal illness, gastrointestinal disease with pain, diarrhea, often a fever. It is thought that there are over 1 million cases of salmonellosis, salmonella infection that occur in the United States every year. However, it's more like 30,000 that have lab culture confirmation that are reported to the CDC each year. And in Oregon, we get about 400 to 500 cases reported per year. Many serotypes that can cause the disease. And we commonly think about salmonella as being associated with eggs, with chickens, dairy products, other meats, and it can also be transmitted by fomites. And if you're not familiar with that term, that would be an inanimate object that is contaminated with the infection or infectious organisms that then you touch and then you become infected. So it can be in a wide reservoir of a variety of animals and environments. I remember when I was a kid, it was a very common pet was the red-eared slider little turtle that was very commonly sold in pet shops. And I think it was the mid-70s where that was banned, where they were banned as pets in the United States because they were such common carriers of Salmonella. So, you know, how do we protect ourselves from Salmonella? You're going to see a consistent theme here with a lot of these, but cook your poultry and your other meats properly as recommended. A meat thermometer is a great way to ensure that. And then immediately after use, sanitize your preparation surfaces and your utensils. Wash your hands. We've heard that before. After handling birds, chickens, reptiles, after contact with pet feces. And I think for children and immunocompromised folks, we want to try to avoid contact between those utensils or those animals that are that we think about. And so backyard chickens have become very popular in the last 10 years, 15 years. And I think that especially if you have small children in the household, you need to be a little cautious and maybe not let them play with the chickens. So mention E. coli. E. coli, a very common bacteria and a normal inhabitant of the intestinal tract in all animals and humans. And many, probably most strains are quite benign and they just live there with all the other intestinal organisms. However, some of them do produce intestinal toxins, enterotoxins, that can be quite serious. Common disease signs are bloody diarrhea, terrible cramping, and it certainly can have more systemic effects, leading to kidney failure, for example. Certainly death is a possibility. There was a book, I don't know if whoever likes Robin Cook, a physician that writes medical thrillers. I think it was the late 80s, he wrote one called Toxin that was about a doctor whose daughter became quite ill with E. coli. And it's kind of a thriller where he's trying to track down the source and try to save his daughter's life. So if you like those kind of things, I'd certainly recommend that book. And avoid cross-contamination. I think quite a common way for E. coli to enter the environment and sort of come home on our raw meat products, for example, is during the slaughter process. It's very easy to contaminate the meat, and ground beef is probably a lot more at risk because there's a lot of surface area versus steak or a roast. Cook the food thoroughly using a meat thermometer. Don't eat raw meat. Don't drink raw milk. Wash your produce thoroughly as well. And of course, wash your hands after handling these things. I need to slow down a little bit or I'm going to be done in a half an hour.
Oh, Bob, carry on.
I know you're hungry. So Toxoplasma, that's one as a veterinarian that I'm certainly very familiar with, caused by toxoplasmosis is caused by a coccidia, a little intracellular parasite called Toxoplasma gondii. Most animals can be infected, including birds. Cats are the natural definitive host. Cats probably acquire it from eating what would be uncooked meat, probably rodents that might have been infected, or possibly exposure to infected cat feces digging in the garden. And that's the way we would get exposed to it. Probably the most common way that people acquire it is from handling raw meat and eating undercooked meat. Everybody is scared about cats and whether they shouldn't keep cats, but really raw meat is the biggest source. Your house cat is not a very common source, but infected cat feces, if you're out working in the garden and a feral cat might have left a deposit, that would be a little bit more likely. And then transplacental is another route of transmission from a mother that gets exposed, and then if she's pregnant, transmitted to the fetus. In a vast majority of people, it's asymptomatic, and I wouldn't be surprised if many of us, if we were tested, would have been infected and have a positive antibody titer from some time in our lives. If a person gets sick, it would most likely cause kind of mild flu-like symptoms that are transient. And it would, in most cases, be rare to have any other serious complications. What happens is after the organisms are consumed, they migrate through the intestinal wall, and they typically are become wrapped in a cyst in our tissues, especially muscle tissues. If we have a normal immune system, that's what happens, and they're likely not to cause any problems. However, in people with compromised immune systems, they have the possibility of reactivating, for example, in someone with HIV/AIDS, sometimes toxo that they had been exposed to decades ago reactivates and causes disease problems. And again, if a woman is infected during her pregnancy, she can pass it to the fetus. If the infection occurs early in pregnancy, it is most likely to cause stillbirth or a miscarriage. Whereas if it happens later in the pregnancy, the child is much more likely to survive, but with birth defects and brain injury that can lead to seizures, mental disability, and other things. The graphic on the lower left shows different routes, and so you can see the sheep and the pig that are sources of meat where they could, she could get the infection, produce, unwashed produce, possibly the litter box, and for the cat, the most common intermediate hosts would be rodents or birds. The picture on the right, everybody likes clinical images, is a fundic photograph, a retina of a person that has a Toxoplasma infection and a great big granuloma at the back of the eye. So I've heard over many years that some obstetricians encourage women to get rid of their cats if they are pregnant or if they're planning to get pregnant, but probably not necessary. Wear gloves when you are handling soil, when you're working in the garden. Be very careful in the kitchen. Handling meat, wash your hands after handling raw meat, wash your produce, and keep your cat indoors, avoid feral cats. To absolutely minimize the risk, have somebody else take care of litter duties while you're pregnant. Let's see. Oh, and as far as the cats that might share this, the cat feces that is infectious, when a cat becomes infected, they go through the same sort of process where the organisms are encysted, and their immune system takes care of it, and then they are not shedding the organism anymore. So it's only for a short period, I think it's 3 to 4 weeks after they are first exposed to the infection from eating the infected rodent or getting exposed in when they cover up their deposits in soil, that they can then release infectious organisms, and after that time period, it's not very likely that they would be shedding infectious organisms in their feces either. So that really narrows down the window where that's a possibility. Okay. Giardia, we've all heard of that, sometimes commonly referred to as beaver fever, because campers can get it, and was thought that maybe the beavers upstream were contaminating the river water. This is an intestinal protozoan that campers and children in daycare are at the highest risk of acquiring, and that is probably because of the reduced hygiene. It can be transmitted from person to person by way of fecal contamination of food, water, especially, like I said, water out in the woods, from animal to person as well. There is, it seems like some of the more recent information is that they think the highest, like the more human infections are caused from other people than from animals. But certainly we can get it from animals as well. Oregon sees about 400 cases per year, and that, interestingly, that's twice the US average. Maybe it's because we like to be outdoors a lot more. It's reported to be the most common intestinal parasite in people in the United States. So unlike some infections like bacterial or viral organisms, where you need a certain significant load exposure to those in order for it to be enough to kind of overwhelm your immune system and get the infection. With Giardia, it only takes a few of the organisms, the infectious organisms, and so that's why it probably gets diluted quite a bit in water, but it only takes a few of those organisms. In people as well, most giardial infections seem to be asymptomatic, and usually our immune system takes care of it. However, some people can become chronic carriers and not be aware of it and be a reservoir of infection. Similar to a lot of the other fecal-oral diseases that we're talking about, gastrointestinal signs, chronic diarrhea, fatty stool, cramping, bloating, weight loss, and there are effective antibiotics to treat this, which is great, but you are pretty sick in the meantime if you get this. And so how do we prevent it? If you are camping, take care of disposing of your waste away from surface water and underground water if you're aware of it, so far from the water's edge. I think it's interesting to note that the chlorine disinfection that we're taught is not apparently effective against Giardia, and that you need to use the filters. So I thought that was quite interesting. And of course, hand washing, we're going to keep seeing that. So maybe before going to the next route of transmission, I'll pause to see if there are any questions.
Bob, there was a question when we were talking about toxoplasmosis about strep being transmitted to humans by pets. Is this a time you would answer that, or either that or hold that thought?
That's not something that I really hear a lot of concern about. I guess I can't address it with confidence, but most of those, well, I think with strep, it is somewhat species specific, probably not exclusively, but much more likely in the species that's hosting it. And I don't hear, as a veterinarian, I haven't heard much concern about strep or counseling our pet owning clients, if we diagnose a type of strep in a pet, that it's a concern. So I don't know that it's a big issue. If anybody else has would like to comment on that, that'd be great.
I can just do a real quick comment, and that is that occasionally there'll be an article about a family that has, where the people have recurrent strep infections, and they test everybody and they don't find anything, and then they swab either the cat or the dog, and they find that those pets are the carriers. The question asked what the frequency of that was, and I don't know the answer to that question.
Okay. So moving on to infections that are transmitted by aerosol, by inhalation. And the one that we're all is in the top of everyone's mind in the news is COVID-19. Various types of influenza, Tularemia, some people might not be familiar with, and some of these other ones, histoplasmosis and cryptococcosis are fungal infections, tuberculosis. So let's talk a little about COVID-19. And this, I think we're all probably have quite a bit of expertise at this point, so I won't be telling you anything that you don't know, but I thought it was worth mentioning and not just ignoring in this talk, since it's on everybody's mind. So a viral disease, COVID-19 specifically, is a viral disease of humans. It's a question mark with animals because it's really not looking like it is an active disease in animals very commonly, although we know it probably came from an animal. So it's caused by the coronavirus called SARS-CoV-2, which is a new strain of coronavirus. Most coronaviruses are species specific. We see them in dogs and cats quite commonly, but they are unique or specific to that species. However, coronaviruses are quite prone to genetic mutation. And so we know that COVID-19 is thought to be, have started in a wet market in China, and most likely from a genetic mutation of a coronavirus in a bat. And first showed its face on this planet, as far as we know, in December. Wet markets are called that because they are places where animals and animal products are sold, including animal urine, other excrement, other body fluids that seem to be popular, whether it's as an aphrodisiac or something else thought to have medicinal value. And so that's where the term wet market comes from. So several animal species are susceptible to the SARS-CoV-2. And the first reported cases in our country in animals were in tigers in the Bronx Zoo. You might remember seeing that in the news. I think there were 2 or 3 tigers and maybe a lion as well that actually developed some mild respiratory signs that were transient. And it turned out that the handler was infected with COVID-19, and it's believed that the handler is who gave the disease to the animals. There have also been rare reports of both dogs and cats that have been infected. And again, these have always been in households where people have come into the house with the infection, and they think that the animals are infected from the people. There's no evidence that an infected animal plays a role in spreading it to people that I have seen. Spread via aerosolized respiratory droplets, talking, coughing, sneezing, and singing that we've seen in church choirs. And but the thing that I think is really important to keep in mind, and especially for the general public, is it can be spread by pre-symptomatic or asymptomatic people that never develop any signs of illness. Common signs: respiratory signs, cough, chills, sore throat, fever, also muscle pain, respiratory difficulty, loss of sense of taste and smell, and apparently gastrointestinal signs as well. Signs develop typically 2 to 14 days after exposure, and the signs can range from mild illness, which fortunately, knock on wood, is what seems to be the case here on the coast. It's when I get the daily reports, as most of us probably do, most of the people go home to recuperate at home. I don't think there have been any hospitalizations in Clatsop County. And we all know the prevention methods. It's been hammered home. Washing our hands, wearing masks, and appropriate physical distancing. Treatment protocols certainly vary dramatically based on the severity of the disease. And also, it's changing. We learn more as more people are treated. And so I think a great thing is that it seems like the mortality rate has declined since we've learned more about treatment protocols that are working. Tularemia is caused by a gram-negative bacteria called Francisella tularensis, I believe. Affects both animals and people. It is most commonly seen in rabbits and in some rodents, and so they can be the source of the infection. Infections can also be spread by ticks and flies, and also surface contact. So, if you handle an infected rabbit, or if you inhale dust from their fur or aerosolized urine, and this is something that I've given some thought to because of the feral rabbit problem we have here on the North Coast, especially in Cannon Beach and Arch Cape. And when the city asked me about ways that we might control the population, and I was looking at things like catch, neuter, and release, that would be a significant health risk to the people that would be handling those animals. So that hasn't gone anywhere. Symptoms of tularemia: sudden onset of fever, headaches, chills, diarrhea, muscle aches, arthralgia, cough, weakness, and progressing to pneumonia. Really, the symptoms can depend on the route of infection, the route of exposure. Can include lymphadenopathy, swollen eyes, cutaneous ulcers, and here are a few clinical photos showing significant lymphadenopathy, an ulcer on what looks like a thumb, ocular swelling. So next we'll talk about direct contact transmission. So I'll pause again and see if anybody has any questions. Okay, so examples of diseases that are spread by direct contact, and you'll notice that some overlap because we know the flu viruses are also spread by a respiratory route. The tularemia, you mentioned respiratory, and what else? Actually, consumption. So leptospirosis is I think has quite clinical significance, certainly in the veterinary field. And for us as volunteer healthcare responders on the coast and worried about tsunami, I thought it was important to talk about. It is a bacterial infection that infects both animals and humans, spread by usually contaminated water, soil, or food with urine. And the most common exposure seems to come from contaminated standing water. So the case rate, the infection rate, increases after hurricanes and floods. Enters both just through, doesn't have to be broken skin. It can enter across the skin as well as across mucous membranes. Symptoms headache, fever, chills, arthralgia, vomiting. This is one that has a tendency to like the liver, so jaundice, other gastrointestinal signs. It is referred to in veterinary medicine as one of the great masqueraders, and so it is often mistaken for other diseases. But it is quite highly infectious, and so when animals are hospitalized with this, they are in isolation. Some people can be asymptomatic, but I would think that that would be like an asymptomatic carrier or spreader. And again, liver failure, kidney failure, even CNS signs are possible. It is responsive to antibiotics, but patients can be quite sick, and so hospitalization and IV antibiotics can be required if it's a severe infection. And you can reduce the risk by not wading or swimming in water that might be contaminated, and especially standing water, stagnant water would be the first place, like a pond out in the woods or something like that. Or in a flooded area, if you've got hip waders, you certainly would want to be utilizing those. And pets can, as I mentioned, it is highly infectious, and so the pets are isolated, and we take isolation precautions when we're treating them. We gown and glove up, booties, masks, gloves, just as you would in any isolation area. The common combination vaccine that we vaccinate dogs with does have several serovars included for leptospirosis, and so it can reduce the risk that a dog will get infected. Ringworm, dermatophytes. Dermatophytosis is the name of a fungal infection of the skin. Not caused by a worm, but it's that ring-like appearance that looks worm-like that gave it its name. Appears as a red patch, can spread quite easily. It's very contagious, both directions, from humans to animals and animals to humans, and of course humans to humans, etc. The spores can live in the soil. It can also, so direct contact with a patient that has it, or contact with a fomite, with a surface where the fungal spores have found a place to rest, can be a cause of infection. When I was, I think I have had ringworm once in my life, and it was in my residency, no, my internship in Kansas. Someone brought in a little tiger cub to the hospital, and it turned out that tiger had ringworm, and so a lot of the students ended up with ringworm that year. Some cats, I don't remember if there were visible lesions on this tiger, but some cats are asymptomatic carriers. There are 3 different genuses, kind of broad categories of fungal organisms. There are many species, but 3 genera organisms that are common. Same organism causes athlete's foot jock itch, scalp itch. There are at least, I don't remember if it's 1 or 2 of the organisms actually fluoresce under a black light, and so that's something that most veterinary hospitals keep to try to diagnose it. And again, because not all of them fluoresce, that's not doesn't rule it out. And then we would do fungal cultures. If it's a localized and small, topical treatment certainly can be effective, but oral treatment might be necessary. As I was typing this, loose clothes and don't share personal items, and I'm trying to think what personal items would we be talking about? I guess maybe a hairbrush. You don't want to share your underwear with somebody else. So I'll move on to vector-borne transmission, unless somebody has a question.
Yeah, Bob, there was a question that went back to the tularemia,
Okay.
and the question was if you know what percentage of feral rabbits such as in Cannon Beach, are positive for tularemia?
That is a good question, and I don't know. If I've read it, which I wouldn't be surprised if I read that somewhere, it didn't stick in my memory banks. I can certainly look it up for you, and we'll try to answer that later on. We can send it out with the email, the follow-up email, if we want to. So vectors are typically insects or ticks. I'm blanking on the word now. Arachnid's coming to mind, but that's not the word I'm looking for. Anyway,
Arthropods.
Arthropods, that's the word, thank you. Insects and arthropods that can transmit via their bite most commonly. Several viruses, West Nile virus and Zika virus, have been in the news. Zika has made its way to the US, and there have been some deaths. Bacterial infections like malaria, Lyme disease, plague, and then the tick-transmitted Ehrlichial and rickettsial infections are all possible. And again, just using a couple as examples, West Nile virus is a mosquito-borne viral disease that was first identified in the US in '99. The number of cases varies quite a bit from year to year, anywhere from as low to 62 all the way up to 3,800 cases per year. Typically, we have very few cases in Oregon. And I imagine that places that are more humid and hot in the summertime, where mosquitoes are much more common, would be a much more likely occurrence. The normal kind of life cycle is from birds to mosquitoes. Birds are the natural host, and they're bitten by a mosquito that then transmits the infection in their bite when they stick their proboscis in to take their blood meal back into an uninfected bird that then becomes infected. But incidental hosts would be people or other animals, and I think horses are fairly susceptible to the infection. It's interesting in this case that birds, as the natural host, are not especially immune to it. There is a lot, I believe that quite a few birds do die from West Nile virus every year. The most common presentation is kind of a systemic, well, most commonly is asymptomatic. Most people that are exposed to the West Nile virus never develop any disease, but 20 to 30% of people that get infected develop mild flu-like symptoms that resolve within about a week or so. Very small percentage, less than 1% of people, about 1 in 150, develop neurological signs, meningitis and encephalitis. And in that 1 out of 150, so about 10% of those succumb to the disease. In other words, probably 1 out of 1,500 people will not make it. And this, really the prevention for this are mosquito, general guidelines for trying to avoid mosquitoes. Long sleeve shirts, long pants, tuck your pants into your socks, use mosquito repellent or clothing that is mosquito resistant or contains mosquito repellent, screens on your windows, and stay indoors during the height of the mosquito biting times of day, especially at dusk. There is no specific treatment, just as there is not for other viruses, and so it's really palliative symptomatic treatment and time, and there is no vaccine so far for West Nile virus. Lyme disease. We've all heard of Lyme disease, first discovered or named for the community where it was first discovered in 1975, caused by a bacteria called Borrelia burgdorferi. It is transmitted by a genus of tick called Ixodes, Ixodes. And there are about 20,000 cases per year in this country. The thing to remember is that the ticks need to be attached for certainly more than 24, probably more than 36 hours before they transmit the disease. It doesn't seem to be transmitted immediately when they first bite. So if you are in tick country and you're checking yourself often and you remove them within 12 hours, your risk is very low. Because dogs are also prone to getting Lyme disease, they are thought to be a good sentinel for where the disease is spreading. The most kind of the typical lesion, we don't see this in all patients, but the typical lesion is this target lesion, it's called erythema migrans, that develops anywhere from 3 days to a month after exposure. Headache, fever, neck stiffness and pain, joint pain, lymphadenopathy, and certainly it's been a big issue that some people seem to develop chronic complications of this, and that I believe that's true. I also think that especially in dogs, I can't address people, but in dogs, I think it had a tendency to be overdiagnosed because we were just using an antibody test, and if they had IgG antibodies, some of those dogs were getting diagnosed as having active disease and being put on antibiotics when probably they had been exposed months or years before, and that was not the cause for their current clinical signs. So as would be expected, the most common risk time of year is late spring and summer when the ticks are active. People, I think, like to look at gross tick pictures, so you can see anywhere from the little nymph on the right, the little seed tick, to male and female adults. So on the East Coast, the Ixodes species is known as the deer tick, most commonly biting deer. But we have an Ixodes tick here on the West Coast as well, Ixodes pacificus, present in the western part of our state and along the Columbia River Basin. And for the past 6 years, there have been 40 to 50 cases per year reported in our state, in Oregon. We have a much lower incidence than most of the country, but it has been increasing. This is the distribution of Ixodes pacificus, and it's really interesting. It's kind of the western third of Oregon. But what is also interesting, I think, is that where the infection occurs, where Lyme disease is typically diagnosed, is in the corners, in the northwest, in the southwest corners of the state, and the Willamette central part of the western Oregon seems to be spared. I don't understand that exactly. And then again along kind of Metro and Columbia Basin along the Columbia River. You know, I used to think that we didn't have ticks on this side of the Cascade Mountains. I really didn't worry about ticks in my patients in the Portland metro area, nor down here at sea level on the coast. But we found a couple of years ago, we found a tick on our dog that had not been anywhere where I would have thought was tick territory. So they do occur. A little bit like mosquito prevention, light colored clothing, tuck your pants into your socks or your boots, long sleeve shirts, use tick repellent. And we know that DEET is the most effective, although also, you know, toxic. We don't like to use it, but I think it works. Frequently check the ticks and remove them, as well as controlling the ticks on your pets. Doing my residency in central Missouri, I feel like I am an authority on ticks and removing ticks. And There are lots of old wives' tales or remedies on how to remove ticks, and they say you need to be careful that they don't leave their head behind. Most ticks do not like leaving their head behind, and that's not a very common thing to happen. But you want to, you certainly can use a tweezers or some other device, but I'm very accustomed to just grabbing them at the base down by their head. I usually just kind of maintain gentle traction and a little bit of a rotating motion until they come out. And one thing that looks like they might have left their head behind, lost their head, is that when they bite, they kind of secrete a cement-like substance around their head. So kind of a little chunk of skin sometimes comes with very tiny bit, like a pinhead kind of thing, but a little bit of skin comes with their head, and you might not see anything that looks like a head in what you removed. So that might be where that idea came from. And now we'll kind of wrap things up with talking about diseases that are transmitted by wounds, penetrating wounds, or exposure to open wounds. Questions? Okay. So, tetanus, whether or not you'd consider it zoonotic is a question. It is certainly very common in horse stables. It likes to live in horse feces, and so in that sense, it's you can acquire it while you're around animals. But cat scratch disease is actually a fairly common transmitted disease from cats, also called cat scratch fever, caused by a Bartonella bacteria. Typically, most cats are carriers and are asymptomatic. They can transmit it, and cat mouths are really filthy. So if you're bitten by a cat, you want to clean it really well, whether or not there's risk of this disease. But cats can lick an open wound, they can bite you, or they can scratch you. And then you develop this really painful, almost like cellulitis, possibly an abscess 3 to 14 days after exposure, fever, headache, lymphadenopathy again. The cats become infected directly from other cats, fighting with a cat that has the infection, or from ingesting a flea or flea dirt where the bacteria is present. It's interesting that it's young cats are more likely to carry the infection. I guess their immune system clears it. Young cats, unfortunately, are also the ones that are more likely to be a little rambunctious and not have manners and scratch and bite. And we, as when we get a new kitten, we sometimes like to roughhouse with them. So that's not such a good idea. 40% of cats, I have a statistic, 40% of cats will carry that infection at some point in their life, again, mostly in the young ones, and most cats are asymptomatic, as I said. So always wash cat bites and scratches. It's a good idea to wash your hands anytime you've been playing with a cat. And if they're older people or people with weakened immune systems in your household, maybe consider adopting an older cat that is much less likely to be carrying that infection. Again, don't play rough with your cats. Don't let your cats lick your open wounds. Try to avoid feral cats. So I saved rabies for last because it's maybe the worst, not the worst in frequency of occurrence, but because it is virtually invariably fatal once symptoms appear. There are extremely rare cases of people that have survived the infection, but it might be able to count on one hand those number of cases. So rabies is caused by a virus that affects the central nervous system, transmitted from infected mammals, and all mammals are susceptible to rabies. The virus from contact with an open wound, whether it's getting bitten or scratched, or just that you happen to have a pre-existing wound and the virus, you get in touch with something that has the virus on it, follows the nerve pathways to the central nervous system and makes its way up to the brain. The 4 species of animals, wild animals that are well recognized to be transmitters of this disease in our country are skunks, raccoons, bats, and foxes. In Oregon, it is almost exclusively bats. Almost never does the state diagnostic lab get a positive test in any of these other animals when they're submitted. But never handle a sick or dead bat or any dead animal with your bare hands. This is a map of where positive animal submissions came from to our state diagnostic lab last year. You can see kind of the western half, mostly, one in Grant County in the east, and they were only in bats. In the last 10 years, I think there have been 1 or 2 skunks and 1 or 2 foxes. But dogs and cats are certainly susceptible to the disease, and if they get infected and they bite us, they certainly can transmit it to people. So one of the things that is important to keep in mind is that because the virus moves up to the brain, one of the more common manifestations in wild animals are abnormal behavior. So something that's atypical for that species, an animal that would normally be fearful of people, whether it's a fox or a skunk, would not be afraid and would sort of seem friendly and want to come up to you. Those are much higher risk that those could be infected with rabies. So especially if you see an animal that's demonstrating unusual behavior, make sure and avoid it. So don't handle sick or injured bats. If you do come across a sick or injured bat, it's probably worth catching it in a safe way and submitting it to the state diagnostic lab. And especially if there is any potential for a pet or a family member to have been exposed. Even if it's just like, well, I don't think so, but it's possible my kid could have touched it. You don't want to take any chances because of the nearly 100% fatality rate. So make sure dogs and cats are vaccinated. And if a person has a risk of exposure, so if there's known physical contact with the possibility of a bite or a scratch, and either if the animal subsequently comes back testing positive for having the infection, or the animal's not available. If it was a feral cat, a dog that gets away, a bat that flew away, you need to get a hold of the health department, and likely they will make the final decision, but likely go through post-exposure prophylaxis. Tough word to say. And as a veterinarian, and especially as a neurologist, I am vaccinated for rabies, and about every 10 years I get my titer checked to make sure I'm still have a protective titer. And other people that would likely get vaccinated would be people like spelunkers that explore caves, people in shelter environments that work with a lot of stray animals, things like that. So just going to run through some tips to reduce the spread of zoonotic diseases. And I'm sorry, this is really simple, but I've come up with a baker's dozen. I had to work at it, but wash your hands frequently, properly with soap and warm water before you eat and after handling animals. Stay current on appropriate vaccinations, the things we've already covered with the examples. Wear long pants, sturdy boots and shoes, use gloves, safety, personal protective equipment, safety glasses and masks when appropriate. Clean wounds and bites appropriately and protect them. Oh yeah, don't forget to wash your hands. Pick up after your pet. And this is why I not only pick up after my own pets, but pick up after other people's pets when I find deposits on the beach or on the walks, because it really is a public safety thing, and the risk that we don't know the health of the animal that left it there, and you can track something home on your shoes even if you're not aware of it, and so the less risk there is, the better. Don't allow your pets to lick your face or open wounds. And this is more for my DART volunteers. Learn safe animal handling techniques, learn how to use the equipment properly, seek assistance when handling questionable or animals that you think might be a risk to you, report any bites or injuries. Always be especially cautious if there are immunosuppressed individuals around, and please remember to wash your hands. So now that was sort of kindergarten, I'm sorry, but this summary is really the kindergarten summary. Animals can give diseases to us. We can give diseases to animals. We want to minimize exposure to animal waste. We want to be safety conscious, both in handling the animals and for us that volunteer for Medical Reserve Corps and such, be conscious of our environment and the risks that are present there. So now to wrap things up, some final comments, getting a little more serious. The World Conservation Society estimates that there are 1.6 million viruses in the world that have yet to be identified. And of those 1.6 million, it's estimated that about 700,000 of those are potential zoonotic risks. That's a lot that we're looking forward to. Emergence of more and more zoonotic diseases is due to ever shrinking separation between us as humans and the wild ecosystem. Increases in the human population, in land use, in deforestation, in infrastructure and consumption is shaking out these pathogens that are kind of hiding in the dark, and therefore increasing the potential emergence of these serious infections to all of us. Now, what can we do about it? As all of us kind of in the world, the global effort really should be to close these live animal markets that sell wildlife and wildlife parts and fluids. In conjunction with that, we need to strengthen the efforts to combat trafficking. There is a lot of trafficking of these animals, both within countries and across international borders. However, lastly, it's really important to kind of change the behavior of people that believe that these eating wild animals or wild animal parts can improve their quality of life, because if we don't change their dangerous consumption behaviors, then black market trade is just going to expand to fill the gap if we're successful at closing the wet markets. So with that, I will, I had a final slide that had a cute picture of a cow with a question mark, birthmark on its forehead. But anyway, questions. That's the end. Feel free to turn on your microphones, and we can